So we will be ready to jump right in and hear your presentation and then hopefully have time for questions after that.
Okay, great. Thank you.
Thank you.
So, well, I'm Carol Westlake, and I am the volunteer chairman of the board of the Safety Net Consortium of Middle Tennessee. So this is not my day job. My day job is as the director of the Tennessee Disability Coalition. And as a part of that, we are a part of the Safety Net Consortium because we care deeply about access to health care for vulnerable populations, and in particular people with disabilities. So the Safety Net Consortium is really a partnership among community agencies like mine, the primary care safety net providers in the state, clinics you would know, Salome, Faith Family, Neighborhood Health, Matthew Walker. I won't go through the 31 sites and the 13 clinics that are part of that, but both faith-based and FQHCs. 3 hospitals, Metro General, Vanderbilt, St. Thomas, are all a part of our Safety Net Consortium. The health department, also from the public sector, and then a number of folks from academia, the Meharry Vanderbilt Alliance, the Meharry Clinics, are all a part of the Safety Net Clinic as well. We really came together 18 years ago, really with a commitment to make sure that our communities would get healthier. Recognizing that we need to bring together healthcare providers, public sector agencies, everybody in the community in order to make sure that we can advocate for, build capacity for, and provide services, healthcare services, frankly, and coordinate those efforts among everybody who needs those services in Nashville, particularly people who are uninsured, but also people who are underinsured. So that really has been our commitment. We really believe collectively that the healthcare safety net as a whole should be viewed as sort of a strategic community investment, right? So people say the safety net and they think of Metro General Hospital. They say the safety net and they think of just a clinic or the clinic that they go to. We really think that it takes all of us to make sure that we have a safety net that lives up to its name, that actually is that kind of mesh that keeps anybody from falling through, as opposed to what we sometimes have, which is sort of this patchwork, maybe some tears in it here and there. So we're really trying to figure out a way that we coordinate with each other to make that kind of thing work. So let me tell you a little bit about our work. We think that the best way that we can work together is to improve access to health care through the use of a coordinated system of entry and support for folks who are uninsured or underinsured. And that really began for us almost 18 years ago in the development of the Bridges to Care program, which is now, we did that in partnership with the health department. The health department still sort of runs a hotline that they call Bridges to Care that helps link people to the care that they need. That is a part of our network. But making sure that people had medical homes, that they had a regular source of care so that they tended to be well, right? We tried to reduce emergency department use. So we kept a lot of data. People really were committed to that, making sure that we figured out what worked and what didn't work. And in the early parts of our project, we probably, about 10,000 people a year we were able to link to a medical home, which we were really proud of. Ran a little pharmacy program, ran a transportation program to get people there, had a big grant to do that. It was a very successful project and proved that it could work. We have continued to do that. We added another project a number of years later, which was Bridges to Care Plus, which got people the specialty care that they needed. It is now called Project Access. Specialty care, it's run by the Nashville Academy of Medicine and the Medical Foundation of Nashville in partnership with our consortium, and it really uses volunteer physicians and then volunteers from the hospital, right? Because you have to have hospital, if you need hospitalization, you've got to do that. And so organizing that and making sure that that's that coordinated effort so people have access to basic care as well as that specialty care. Safety Net Consortium is not doing that themselves, although many of our partners are, but trying to make sure that we're all doing that together. In more recent times, and what kind of brings us to a project today, is the fact that we really recognized that we needed to sort of modernize our awareness, our access, and the way we coordinate and get people connected to care. So because what we, as we share data together, what we learned from each other is that together in 2017, our safety net clinics and then the partnerships with the hospitals served about 51,000 of Nashville's uninsured population in a medical home. Well, there's probably over 100,000 folks, so we're only about halfway to where we need to be. Our clinics know that they have more capacity, want to keep people well, keep them out of the ED, keep them out of the hospital if we can. And so we developed a program called My Healthcare Home, web-based. We kind of looked around, talked to some focus groups of patients who had found their ways to clinics, and came up with this idea that we would sort of follow a big box store concept, you know, like you go to the Home Depot website, you put in your zip code, you tell them what you're looking for, and they tell you where your closest store is, and whether or not they have that thing, right? So we sort of set up that, cobbled together some money. I should say that we are sort of all volunteer. There's currently no staff at the Safety Net Consortium. Everybody kind of kicks in and participates together. It's been that way for the last 12 years or so. And got this website developed, and then we have been using informal ways to kind of get that out there. In January of this year, we had about 2,400 user sessions on that website, just doing word of mouth and that sort of thing. But we really want to get to that other 50,000 folks who are uninsured and who don't have a regular source of care, who aren't in a medical home. And that includes folks who are in minority communities and communities that for whom English is not their first language. So we have translated our website into 9 different languages in order to be able to get people to go in and connect directly to a clinic. You can find the closest clinic, the maps come up the way they do on other kinds of things, and then you can click through to that clinic to make an appointment. So those are things that are really, really important to us. Just a couple of other things that we've worked on in the past. We have a diabetes improvement project. Again, everybody getting together and saying, what's a healthcare problem? Not only do we want to address barriers to access to healthcare, we want to make sure that we're doing something about getting this community healthier. So for the last number of years, our clinics have gotten together and work regularly, monthly, on strategies to make a dent in the high rate of diabetes and the ill effects of diabetes within communities. I just saw Janie Day out in the waiting room. She's going to be in next. The Second Harvest Food Bank and the Safety Net Consortium partnered on a health and hunger project this last year, did a big summit to try to say, how do we address that social determinant of health? So really what we're trying to do is getting we're a neutral convener to get all the healthcare providers and community folks together and to say, how do we tackle problems together? So the specific project that we're asking for really this year, our request is for $125,000 to really do 3 things. To get that next 50,000 folks, as many of them as we can, connected to a medical home. We think we have capacity in our clinics, but we really need to get folks there and get them in active wellness and other kinds of programs. We want to be able to provide targeted services to uninsured high-risk patients who are in our Project Access Specialty Care program. What we found is that about 2% of those patients really cannot navigate those systems themselves. They tend to be high users of those volunteer services, and we think we can build more capacity by doing some hand-holding and getting them to the right care at the right time. And then third, to really build the infrastructure for the Safety Net Consortium as an organization to be able to maintain My Healthcare Home actively, to be able to continue to address those problems, and to really get the planning and the data pieces in place that we know we need to demonstrate the outcomes that have to happen. So that's sort of a short speech on where we are. We think that a year's worth of funding can get us to that kind of sustainable infrastructure and move us beyond just the volunteer efforts of the folks who are doing these things, so that we can really move things to the next level. We are all about. Oh, go ahead. Question?
Oh, no, you can finish.
Okay, I'll just say.
I do have a clarifying question.
Oh, okay. Yeah.
So it's just that this is
No.
Can I just repeat back some of what you said to see if I
Yes.
understand?
Yes.
Oh, yeah. You do.
Sure.
The Safety Net Consortium exists informally right now. You don't have a 501c3.
We are actually a 501c3. We are a not-for-profit limited liability corporation of the St. Thomas Foundations.
Okay.
So we have a 501c3.
Okay.
And they are our, I will say, fiscal agent as the way to explain that. Okay.
Right.
And that has been the case for the last 18 years.
Okay. So currently, you don't have funding, this funding would shift you to your own standalone 501c3.
We think that after 18 years, it is time just to move us to our own 501c3.
Okay.
After St. Thomas was merged with Ascension, managing money through that large organization is a much more difficult thing than it used to be. Staff left that made the deal in the first place for the LLC, do you know? And so we think it's time to develop.
Okay. The Safety Net Consortium is made up of how many people? Who is it the board that runs it right now?
The board runs it right now, and the board has a representative from each of the Safety Net clinic systems in the community. There's 13 of those.
Okay.
It has a representative from Vanderbilt University Hospital.
Okay.
It has representatives from Meharry, representatives from General.
Gotcha. And the issue is that those clinics have capacity to serve people who are 200% or under the poverty line, who are uninsured. But it's about outreach. So you've created a website, and you're using that website to try to map out.
To get those to map that out, to be able to connect we think about 50,000 folks in the community who do not have access to a regular source of care. And it's not just about getting, of course, uninsured trade for the clinics, right? Because it doesn't pay. But really making sure that folks have a medical home. I mean, the commitment is, if you have a regular source of care that is more coordinated, that focuses not just on episodic problems, but keeps you well. So, for example, one of the things that we have done to market the My Healthcare Home website is to work through the local chapter of the Society for Human Resource Management, and helping employers who don't offer employer-based insurance use that site to get their employees a source of regular care, affordable regular care, because the Chamber of Commerce has pointed out how sort of presentism, people going to work when they're sick or not having a source of care, and absenteeism is a real problem. So it's not, it is about using the clinics and the hospital's capacity, but it is much more about that regular source of care, and then coordinating that so that everybody on an equitable basis has access to the right services at the right time. And that really, with a focus on, from our perspective, there isn't any equity without health equity. I mean, fundamental to a community. And by increasing the capacity of our system to, on a coordinated basis, make sure that everybody gets the right care at the right time, it makes much more sense and keeps us together.
So is this your total need, or are you reaching out to additional funders?
We are reaching out to additional funders. We do have some funding. We currently have some funding through a CMS grant that's part of Vanderbilt. That is the Transforming Clinical Practice Initiative. And our Safety Net Clinic is a practice. Is a safety net practice as a part of that. Dr. Rothman at Vanderbilt is the chair of that, and so we operate with some funds from that right now, and use that money to develop the My Healthcare Home website in the first place, for example. The Health and Hunger Project was a part of that effort as well, so we do have some funding. And other kinds of support. There is a group of funders that are putting together a funding consortium to take a look at some healthcare things. We're talking to the HCA Foundation, Joanne, last week.
It just sounds a lot like it's seed money to help you kind of get your organization going.
Yeah.
So I'm just thinking about, what happens in a year.
Yeah.
In terms of if this went away, what's your sustainability plan to make sure things don't fall apart on you?
And absolutely, absolutely. And it really is to strengthen and to grow our infrastructure and to be able to move some of these projects into a more implementation phase. I mean, I think we have done a tremendous amount with a very little bit of money. We are actively working with funders, actively working with the hospitals who are feeling like they can probably kick in some if we really kind of get these things going. So there are a lot of conversations happening, and we do have, I think, a pretty strong plan for sustainability.
Are you going to hire a director?
but we're going to hire a project manager, essentially.
All right.
Thank you so
Strictly
much.
over.
Thank you.
Thank you very much. Appreciate it.
Coming.
Thanks.